Welcome to the University of Michigan Dentistry Podcast Series, promoting oral health care worldwide.
Please answer the next 5 questions. These will be slides, and we'll give you half a minute on each slide. Name the tissue found in the top half of this slide. Number 2, what type of cartilage is this? Number 3, what are the names of the groups? What name is given to these groups of cells? Number 4, what type of cartilage? Number 5, again, what type of cartilage is this? Cartilage is a special kind of connective tissue. It's found at the end of long bones that support the weight of the body. The ear cartilages are a special kind of cartilage. There's cartilage in the larynx and the trachea. When I say that it's a special kind of connective tissue, it's special in that it does not have blood vessels, so it's an avascular tissue. In connective tissue, we have to account for cells, fibers, and ground substances. Let me diagram these for you on this chalk talk here. Now, cartilage cells are big, rounded cells. Draw the nucleus. And the cytoplasm is full of fat and lipid, and it gets washed out in the preparation of the tissues. Big round cells. Well, let's put a couple cells in here. And they're many times found in groups. These cartilage cells are called chondrocytes. You'll see the term chondr used as a prefix for tissues concerning cartilage. So these are chondrocytes. They elaborate fibers. These are the collagen fibers, just like a fibroblast. They're produced by the chondrocytes. These are collagen fibers. But in cartilage, the mucopolysaccharide that's elaborated masks the fibers so that you don't see the fibers. Now they're there, but the refractive index of the cartilage ground substance masks that, so you can't see the fibers very well, but they're there. So now we've accounted for the cells, fibers, and the ground substance. Now, this mucopolysaccharide ground substance is a little bit different around the cells. So it gives an appearance kind of like a capsule in the immediate area. It'll stain a little bit different. And some people call this the capsule of these cartilage cells. Let me put some terms in here for you. This matrix right around the cells is called a territorial matrix. And that in between groups is interterritorial. That's matrix. So we've got groups of chondrocytes surrounded by fibers and ground substance. The ground substance is, of course, mucopolysaccharide, and in cartilage, it's very concentrated, and it masks the fibers that are in the connective tissue around here. Let's draw in, just for completeness, another group of cartilage cells, and these would all be from the same cell. One cell would divide, and you get these groups of cartilage cells. These groups are called isogenous groups, which tells you something about the fact they all come from the same one cell. Isogenous groups. There are three types of cartilage: hyaline, fibrous, and elastic. Hyaline cartilage is found at the ends of long bones. Elastic cartilage is found in the ear. The cartilage of the ear are elastic cartilage. In between the vertebra are connective tissue discs. These discs have a fibrous cartilage component to them. On our diagram, we have what would appear as hyaline cartilage. It's glassy-like. The fibers are indistinct. This would be the appearance of hyaline cartilage. Let me sketch for you now the appearance of elastic cartilage. Now, the cells in cartilage are rounded. And the cytoplasm is washed away, at least the components of the cytoplasm. They're high in glycogen and lipid. Now, in elastic fibers, you can make out the fibers, and they have a whirling and a swirling appearance. These are the elastic fibers. And we'll show you a demonstration of that on the microscope. Let's put in a few more chondrocytes. That would be the appearance of elastic cartilage. Now, fibrous cartilage, again, we've got rounded chondrocytes. In fibrous cartilage, you make out the fibers have a tendency to go in the same direction. You have good, strong collagen fibers in fibrous cartilage. So hyaline cartilage is found at the end of the long bones, elastic cartilage in the ear, and fibrous cartilage, a typical place that we'll look for it is between the vertebral bones themselves. Now let's look at these tissues in the microscope. Hyaline cartilage has a glistening appearance in the live state, a white, glassy appearance. Let's look at a low-power section of a tracheal cartilage. This is hyaline cartilage. You'll notice the covering now is a fibrous connective tissue covering. That's found on both sides of this piece of hyaline cartilage. The term for that is perichondrium. In this case, it forms a fibrous connective tissue covering on the periphery of this piece of cartilage. Even at this power, you can see the groups of cells, the isogenous groups, and the different staining characteristics of the ground substance, the so-called matrix. Now we're going to go to a higher power, see some more of the cell detail. Notice the cytoplasm is washed out, and all you see is the nuclei. Here we have the interterritorial matrix staining real pink, and then the darker territorial matrix right around the groups of cells. This is interterritorial matrix here. This is the territorial matrix. These groups of cells are called isogenous groups. At high power, we get a better definition of the isogenous groups. Here is the territorial matrix, and here the interterritorial matrix. One can depict at this power and have an understanding of the types of growth for cartilage. There's appositional growth and interstitial growth. Now if we return to the slide, we'll see an example of interstitial growth. These cartilage cells divide and multiply and seem to push out, and this is called interstitial growth, growth from within. Now an example of appositional growth, let's go to the periphery here. There's some artifact there. Now here we see the perichondrium, and this growth is applied to the outside. These cells multiply and divide, differentiate from the fibroblasts in the perichondrium, and this accounts for the appositional type of growth of cartilage. So with cartilage we can have two kinds of growth. We can have growth from within, which is interstitial growth, or we can have growth applied to the outside, appositional growth. Now I want to show you the other kinds of cartilage. Next we'll go to elastic cartilage. In elastic cartilage, elastic fibers are very clear. They shine and appear quite brilliant red, and they whirl and swirl around the cartilage cells. This type of cartilage is found in the cartilages of the external ear, also some in the eustachian tube, and I want to show you some elastic cartilage that's found in the epiglottis. On this low power section now of elastic cartilage, we see the perichondrium on the outside, many cartilage cells, rounded cells, and you can pick up the brilliance of the elastic fibers interspersed around the cartilage cells. Now let's go to the next power. Perichondrium is on the right, and elastic cartilage here. See the brilliant appearance of the elastic fibers? Now at higher power we'll see greater definition of these elastic fibers. The cytoplasm is pretty well washed away, and all we see is the nuclei of the cartilage cells. But here in the matrix you see the glassy-like elastic fibers, very distinct in this particular kind of cartilage. Elastic cartilage is found then in the external ear cartilages, eustachian tube, and in the epiglottis as shown here. Now we'll go to fibrous cartilage. Fibrous cartilage is just like dense, regular FECT. It appears like ligament and tendon, but there are cartilage cells present. Now, in the intervertebral disc, that's between the vertebral column, in the column itself, there's bones. There's also a connective tissue disc spanning the two bones. Now, let's look at a section under low power of the intervertebral disc area. Down here, this bone. Here's the disc, the fibrous connective tissue disc. That's nucleus pulposus in the middle. And here's the next bone. Now, it's this tissue right in here that's the fibrocartilage. And we'll look at that now under medium power. Nucleus pulposus to the left, and here's the fibrous cartilage. You can see the regular appearance of the collagen fibers here. And these are the cartilage cells. If we go on the other side of this nucleus, there we see the fibrocartilage over here. Now at a higher power, we see the chondrocytes, these rounded cells, and the heavy fiber component found in the matrix. This is fibrous cartilage. It's a dense, regular, fibroelastic connective tissue with cartilage cells in it, found in the intervertebral disc. Now, to review, cartilage exists in three forms. In the hyaline cartilage, where the fibers are masked by the homogeneous ground substance. That's found at the ends of long bones. We've shown you elastic cartilage, which is found in the cartilages of the ear, eustachian tube, and the epiglottis. The fibers are bright and glistening and appear very eosinophilic and wave and swirl around the cartilage cells. Fibrous cartilage is found in the intervertebral disc, and there's a heavy collagen fibers that run in the same direction. That gives us a good idea of the histological characteristics of the three kinds of cartilage. In review, I must add, remember that cartilage is avascular. There's no vessels in cartilage. Cartilage is formed of cells, fibers, and ground substance. Remember the fibers in hyaline cartilage. You don't see them histologically, but they're there. The chondrocytes is the cell that produces both the fibers and the ground substance elements. That concludes our review of cartilage. We now have a post-test on cartilage. We'll give you 30 seconds for each slide. Now, we want the name of this tissue in the upper half of this section. What type of cartilage is this? What name is given to these groups of cells? Number 4, what type of cartilage is this? Number 5, what type of cartilage is this? Let's see how well you did. We'll review the answers to both the pre and the post test. This is perichondrium. It's responsible for the appositional growth of cartilage. It surrounds the outer surface of cartilage. This is fibrous cartilage. Isogenous groups is the answer. This is elastic cartilage and hyaline cartilage.
You've been listening to a presentation from the University of Michigan School of Dentistry, which is dedicated to supporting open learning and open educational resources. This recording is licensed under the Creative Commons. It may be reused and redistributed for nonprofit use. Please attribute materials to the University of Michigan School of Dentistry and redistribute under this same license. For more information on how this and other University of Michigan School of Dentistry recordings may be used, visit www.dent.umich.edu/license.